Good morning, everybody, and welcome again to our information Zoom this morning. It's lovely to see all of you. This morning we're talking about pain, and I'm going to hand over to Kathy.
Yes, good morning, everybody, and thanks for coming to listen to this information session on pain and Parkinson's. The definition of pain in the Oxford Dictionary is an unpleasant feeling caused by injury or disease of the body. Pain is described by the International Association for the Study of Pain as an unpleasant emotional experience associated with actual or potential damage. It is not only a physical sensation, but it's influenced by attitude, personality, social factors, and personal beliefs. No two people experience pain in the same way. If it's hurting, then it's pain. No, every experience with pain is vastly different. Pain is really whatever the individual describes it as. There are two main types of pain, chronic and acute. Chronic pain is very different from acute pain. Acute pain is pain that lasts for a short time and is usually caused by injury or disease which can be treated and resolved with no further pain. Acute pain usually decreases in intensity as the healing continues. Chronic or persistent pain is pain that lasts for a long time, usually longer than 3 months, and its intensity fluctuates. Chronic pain is the most difficult type of pain to manage. A sensitized nervous system may amplify or make the pain worse. The better pain is understood, the better it is able to be managed. It's very important that the details of the person's pain are recorded for later discussion with the neurologist or the GP. This will aid in the management of the pain. Things to be noted about pain are: is the pain new? Where is the pain? What does it feel like? When does it occur? How long does it last? Are the Parkinson's medications effective in managing the pain? What eases the pain or what makes the pain worse? This gives a good basis of knowledge for the doctors to be looking at how to manage your pain, how it can be treated. Pain is a non-motor symptom of Parkinson's disease. It is often an overlooked and undertreated symptom of Parkinson's, making it very unpleasant symptom to manage, reducing quality of life. Around 70% of people with Parkinson's experience pain. It can sometimes be more problematic than the motor symptoms. The pain in Parkinson's can take many forms. These include muscle stiffness, which is a very common type of pain felt by people with Parkinson's. It comes from the bones and muscles and is experienced as an ache around joints, arms, or legs. Muscle stiffness can be due to undertreatment with the Parkinson's medication that requires a higher dose to manage those symptoms. It's more rare that you would have some Parkinson's pain due to over-medication. Motor symptoms of rigidity and slowness of movement can lead to pain and decreased mobility. It can also limit the range of motion. Rigidity stops muscles from stretching and contracting. People who have underlying osteoarthritis and osteoporosis can also have gait disturbance, which causes more stress on the joints or the spine, and that increases the pain. You notice a lot of people with Parkinson's have a stooped gait leaning forward. Another type of pain in Parkinson's is dystonia. It is a prolonged muscle contraction or involuntary tightening that changes posture. It may display as curling or bending of the toes and feet. It can be very painful. It can also occur in the hands and the neck, and it's sometimes more severe upon rising in the mornings when the dopamine levels are depleted in the person's system. It's more common in people who are diagnosed at under 40 years of age, but it can affect everyone with Parkinson's. It occurs mostly when treatment is beginning to wear off and the medication is then less effective. Another type is nerve pain or neuropathy, and that's a shooting electrical type sensation that travels along the nerve endings. It can feel like numbness, tingling, or burning, usually in the feet or hands. It can be caused by diabetes and also by vitamin deficiencies. And this type of pain is common in people with osteoarthritis in the lower spine or the neck. People with Parkinson's may have those stooped shoulders or a bend at the waist, and this also increases that pain. Another type is central pain, which is a syndrome that occurs because the area in the brain that processes sensation is not working properly. This type of pain can be focused in one area or widespread, and it can be a burning sensation or short, sharp bursts of pain. Again, the symptoms vary from person to person. Abdominal pain is also problematic for many people with Parkinson's. People with Parkinson's often have issues with constipation and also gastric reflux. This causes pain and discomfort due to that bloating and to the slow movement of waste products through the intestines. The burning sensation in the stomach occurs because the muscles, the tiny round sphincter muscles at the top of the stomach, don't close off properly because, as you know, all muscles in the body are affected by the Parkinson's. When those muscles don't close off properly, then the acid can come back up into the bottom of the esophagus, causing that burning sensation, gastric reflux. Headache also happens to any time in the Parkinson's journey and can sometimes be caused by the Parkinson's drugs, but can also be related to the neck and shoulder stiffness and pain. Often people with Parkinson's have a lot of stiffness and rigidity in the shoulders, and that can increase that risk of headaches. Also, people suffer with a burning type pain in the jaw and mouth, and this can be because of the Parkinson's medication. It increases that feeling of thirst or dry mouth sensation, and that can lead to tooth decay and gum disease. Pain can impact on the mind, increasing anxiety, fear, anger, and depression. Anxiety makes Parkinson's symptoms worse for everybody. Every single person has a different journey with Parkinson's, but they all say that if they're stressed and anxious, then their symptoms are worse. Hypervigilance can really increase that pain too. Worrying about when it's occurring, how bad it's going to be, drives that stress and anxiety. Taking control over the pain can improve the quality of life. It is therefore very important that pain is assessed and the cause identified to better manage the pain. Pain management includes effective reporting of the pain so that a treatment plan can be worked out. The aim of pain management is to identify the cause of the pain, manage motor symptoms well, maintain or improve exercise, utilise complementary methods to help to manage that pain, things like hot pack, and using the pain medication as necessary. Now, to achieve this goal of managing pain well, to improve quality of life, you need to take particular note of the pain and report it to the neurologist or the GP. You're not worrying the doctors when you tell them and explain to them what's happening. You need to be looking how you can identify, if possible, the cause of the pain. You need to check for infection because this can make the Parkinson's symptoms worse, increasing the pain. Check for underlying comorbidities, particularly linked to the aging process. Many people have Parkinson's as well as numerous other health issues as they're aging. Medications for Parkinson's need to be regularly reviewed for better symptom management. Because whilst you have a diagnosis of Parkinson's, nothing can stop those dopamine-producing cells in the brain from dying off, hence the need for monitoring of the medication. Exercise is very, very important to try and manage pain and to maintain your quality of life. Lack of physical exercise makes the pain worse. Physiotherapy can help, speech therapy is also able to assist by keeping facial muscles supple and flexible. Improving general fitness and core fitness lowers that risk of falls, which can contribute to pain. Maintaining a healthy weight reduces pressure on the joints. Monitor for and treat depression. This is very important. And it can really make the pain worse if that depression is undertreated or undermanaged. Regular pain medication can also help to manage the pain associated with Parkinson's. It has minimal side effects, things like paracetamol. You need to be doing this in conjunction with your doctors. Massage therapy can be very helpful, especially when you have that dystonia type pain. Hot packs. Also thinking and remembering not to be sitting or standing for prolonged periods. That's not good for people with Parkinson's. Good management of constipation can reduce pain due to bloating. Acupuncture and magnesium supplements can also be quite helpful in managing rigidity and stiffness. Botox can also be helpful in managing pain associated with dystonia. Stress makes the Parkinson's symptoms worse, so reducing stress is very important. Engage in activities you enjoy to reduce the levels of stress, reading, yoga, relaxation, breathing. And think about not just giving up the pastimes that you enjoy. You need to be looking at how you can modify the activities that you enjoy so that you can continue participating. Maybe not exactly in the same way, but you want to keep up those things that you enjoy, that gives joy to your life, helps reduce your stress and anxiety levels, and maintains your socialization, all of which are important to try and reduce that pain. Thank you very much for listening.